सर आपको
Good afternoon to everyone. Myself, Dr. Snehil Gupta. I am an associate professor of psychiatry in AIMS Bhopal. Today we'll be talking about this is the first lecture in our lecture series under Doctor to Doctor desktop. So my presentation would have following areas that I'll be covering, starting from what do you mean by postpartum, how it is different from another common condition that is known as postpartum blues. Then, how common is the postpartum depression? What, how to manage? So, under these headings, we'll be discussing today's lecture. Uh, what do we mean by postpartum depression? So, you see, postpartum depression, it usually happens following a childbirth or maximally within 6 months of delivery. A female can experience symptoms of major depression with context related to childbirth and motherhood. It may be continuation of postpartum blues, which is a milder form of depression, delivery, but it can extend to say 6 months also. Even within 6 months of delivery, such kind of depressive symptoms can emerge in a young mother. So हमको ये समझना है how it is different from postpartum blues. You see, postpartum blues are the mild and transient depressive symptoms. They are just symptoms that are not at the level of disorder. Usually, they start 2 to 3 days after delivery. The symptoms peaks at 5 days and usually subside by anxiety, sleep issues, tearfulness, mood swings, and lack of attention, lack of affection for the baby. It is very common, almost in every pregnancy or delivery you may find it. And treatment usually involves emotional support, reassurance to the mother, advising them to maintain adequate sleep. How common is the postpartum depression? So it is common that so in the general population the prevalence of depression is 10%, but here it is 15 to 20%. What are the risk factors for postpartum depression? In case of young mother, history of psychiatric illness, there is family history of psychiatric illness. If the delivery was complicated or if the pregnancy was complicated, if there is a poor family support, there are some personality in a female which makes her vulnerable to postpartum depression. For instance, if the mother is having negative emotions most of the time, negative thinking pattern, poor adjustment, so that predisposes her to postpartum depression. Many times, female receive psychotropic medication for her psychiatric problem, but suddenly if medication is stopped, maybe during pregnancy or just after delivery, for fear that child may uh, get those drugs through lactation. So, at times, sudden stoppage of psychotropic medication can lead to postpartum depression. Now, next question that comes: what are its causes? Why a female happens depression after the birth of child, which is considered a very otherwise a very good thing in life, one very positive aspect in life that a woman is attaining motherhood. So, what are the causes of postpartum depression? So it includes biological causes and psychological causes. When it comes to biological causes, it means change in the gonadal hormones. So during pregnancy and after delivery, there is a significant change in the gonadal hormones, which affects the monoaminergic system. Like they affect serotonin, dopamine, and norepinephrine, which are implicated in mood disorders or anxiety disorders. However, there are also some psychological factors that can result in postpartum depression. It includes, for instance, transition to a new role, which requires lots of adjustment. There are heightened emotions and responsibilities on part of the mother, which can bring tremendous stress. And there can be relationship issues, societal expectation from mother. So these are the psychological causes of postpartum depression. You see, we have depression in other population also in non-pregnant ladies or in not in those who are in post-delivery state, but how to differentiate those depression from postpartum depression. So there are some specific symptoms which is contextual to the pregnancy or delivery. For instance, if a mother is unable to sleep despite baby is asleep, then it is an indicator of some psychological symptoms. Like if mother is having guilt related to inability to take care of baby, like if mother feels an inadequacy or lack of ability to cope with the need of an infant. There is lack of enjoyment to a new role, that is of motherhood. And there are panic attacks, there are obsessional fear, irrational intrusive fear that what would happen to the health of the child, the baby will fall ill. Those kind of apprehension can also result, they are also sign of postpartum depression. Now, there are some critical issues when it comes to postpartum depression, maybe related to the diagnosis or management. The most important thing is that often the treating team or family have focus on the uh, baby, the well-being of the baby, and hence the well-being of mother is often what happens is overlooked. Mother may suffer from some medical issues which may include severe anemia or thyroiditis. So the symptoms of these medical conditions can mimic that of depression. So a doctor needs to differentiate between the two. Often a female is not open to discuss these psychological issues, considering that she may feel embarrassed, that she may have shame, that I should be happy when I have delivered a baby, and now I am having sadness, I am not interested in taking care of baby, I am feeling lethargic. So that can result in a sense of guilt. So it may happen that mother doesn't disclose such symptoms to the family members or treating physician, or they may attribute such depressive symptoms to the underlying fatigue, lack of sleep, adjustment issues. So people try to normalize these psychological symptoms. Rather, they are pathological and they may need attention and treatment. What would happen if we don't treat postpartum depression? What could be the complication? Complication includes the episode would turn into a chronic depression, can lead to suicidality in a mother. Even mother can have harmful tendencies towards the baby. So this is another critical thing, that the life of baby is also at risk if mother's mood symptom is not taken care of. Like poor attachment with baby because of postpartum depression can result in development issue in a child at the later stage. So as we all know, mother child attachment is very important for the healthy development of the child. The question is how to identify it. You see, if we find that symptoms, the mood symptoms is out of proportion to what is expected in a mother due to adjustment issues, one should think for postpartum depression. Okay, if mother's functioning is significantly impaired, there are some scales which is used for screening, like Edinburgh postnatal depression scale, postpartum depression rating scale. So we can screen a mother on these scales. Okay, and if the mother has a certain cutoff score, that indicates that she is screening positive for postpartum depression, and further evaluation and intervention is required. The last part is how to treat this condition. This is the most important part. So treatment involves two aspects: the non-pharmacological aspect and the drug aspect. So what are the non-pharmacological aspects? First of all, we need to psychoeducate the mother or family members about the condition, the postpartum depression. Second is we need to have some group intervention we can do. We can have a group of young mothers and we can psychoeducate them about the depression. We can form a social support group. There are some specific treatment like cognitive behavioral therapy or interpersonal therapy. Likewise, literature has shown if the depression is severe, including suicidality and other aspects, electroconvulsive therapy is a very effective way of treating such condition, which is also relatively safe. People are often apprehensive that ECT can have complication, but in contrast, it has been found to be very safe and effective in postpartum depression. There are drugs which are also safe, can be given as per the need of the mother, the lactation status, and other things. So we can try antidepressants. There are benzodiazepines which are used for sleep and anxiety reduction, and there are some hormonal therapy like some hormone replacement treatment or some omega-3 fatty acid. So overall, these are the few things that we want to highlight through this brief lecture. To summarize whatever I have told, childhood and the perinatal period is a phase of overwhelming demand for the mother. There are numerous adaptations and responsibilities that make women vulnerable for various mental health issues. Postpartum depression, as I have mentioned, is often underdiagnosed condition. We need to differentiate it from the postpartum blues. In this, we can do by identifying the duration, severity, and the extent of impairment in the mother. And most importantly, timely screening, early diagnosis, and prompt management is the cornerstone in managing this condition. So, these are the references for concerning my presentation. I request the audience to go through these references, and thank you. If you have any question, the same can be uh, asked through my email ID, which is snehil, snehil, snehil dot psy @aimsbhopal.edu.in. Thank you very much.
Next.
उनका खुला है कैसे?
Minimize करती है।
शो कैसे?
इसको ना मिनिमाइज कर देंगे,
इसको साइड को
इसको मिनिमाइज कर देंगे, ये बीच वाला ऊपर पे यूट्यूब
ये
हाँ इसको भी मिनिमाइज कर देंगे। 2 मिनट उनको भी पैरेलल में काम
इसको भी एंड कर देते हैं अभी के लिए।